I'm just starting the recording so the recording can go up on the DLE. We talked about qualitative research methodology in early October. It's that long ago now, isn't it? And then we had quantitative methods. There's also, to supplement this session, there's also a recorded narrated PowerPoint from Bridie Kent around quantitative research analysis. So that's to supplement this session, but this afternoon I'm going to be talking about qualitative research analysis. And if you have any questions about quantitative research analysis, then you can ask them, and Rona and I will attempt to answer them, as neither of us are quantitative researchers. So, oops, skipping ahead. So what sort of questions am I asking, or what kind of questions are being asked when you're reading qualitative research? You're often asking questions about what's going on in a particular social setting. You're looking at which people take part and the relevant variables to the study. You're often seeking to discover a meaning in some sort of activity. So when you're reading research, you might be looking at why people do things, why people behave in certain ways, why people undertake certain behaviours that are risky, all sorts of questions around social situations and social settings. Different concepts and categories can be used, and we're often, not always, but we're often thinking about what people think, how people feel about a particular setting or situation. So looking at people's perceptions, people's understanding, people's experiences of a particular social phenomena.
Somebody's saying they can't see the PowerPoint. Is it up?
Is it?
They said, have you put the PowerPoint up, as I can't see it?
The PowerPoint's on the DLE. All right. Is it visible? Visible? Oh, sorry. They've changed some of the settings on webinars, and now you auto record. So I'm just clicking different buttons. So hopefully everybody can see it.
Yeah, it looks like it.
Okay, good. So the questions that you're asking, and so the research aims and research questions that you may have been looking at, if you've been looking at qualitative research, may be associated with some of these particular questions. The sort of data that you'll be collecting, or the sort of data that you'll be looking at in terms of the research that you're reading, might be observations, observational field notes. You might have transcripts of conversations. That might be in terms of an actual formal interview where a participant has been interviewed using an interview guide. But equally, there may be some transcripts of conversations in terms of a focus group, in terms of a consultation. All sorts of different conversations can be recorded, either in written format or taped. You can use a video recording, an audio recording, but equally you could make recordings of events using photographic evidence. So there's an enormous amount of data that could be collected in terms of interviews or conversations. Equally, you might be looking at health records or case studies or reports. You might be looking at all sorts of documents that supplement somebody's experience. You might be looking at media reports. You might be looking at artistic impressions, drawings, sculptures, films, poetries. All sorts of material can form the data in a qualitative study. I don't know if any of you have got particular examples that you're analysing that have used less common methods of data collection. We tend to focus on interviews, observations, participant observations, field notes. In health research, there's not an enormous amount of published material using sculpture, I don't think.
No, I don't think So you do have art and death, that's one of them. And the other thing I would say is some of it's around what's on the internet now as well. So you're looking at web content.
Yes. So, and that's open access. I know.
Ungated.
Ungated. And Rona's got specific experience of that.
Indeed. Using a web content analysis approach and a narrative analysis, looking at forums and blogs on people's experiences in end-of-life care and decision making.
So
it's quite useful because it's ungated, and it's the pros and cons. It's anonymous, so people are writing in with anonymity, so they feel they can say what they want, but that's also problematic in itself as well. It's an interesting field. It's one that maybe we should use a little bit more.
All the issues I'm immediately thinking about is honesty.
Yes, exactly.
Because
absolutely, we don't know. We have to take their word for it and what they're saying. You see, that's the problem with it. And that's the anonymity and hiding behind these user IDs or fancy names, or they put themselves on these forums. They can do that. Some of it is valuable, and some of it you can sort of align with some of the grey literature that's out there, but some of it isn't. People's just using their own opinions.
So an awful lot of different types of data you could use in a qualitative study, and I'm sure you're coming across different forms of data in your analysis of your different fields. So some of the key issues that we need to think about when we're looking at this sort of data is the purpose and the motivation. So why is it there? What's the personal motivation, political motivation? There might be some bias, theoretical different purposes. As we've just said about blogs and online content, there might be issues also around honesty, because as we've just said, people can't be checked, for want of a better expression. You can't get validity of what they're saying. Equally, some of the issues are around access to the data. So whose data is it? If you're collecting observations, for example, on a particular ward, whose permission do you have to get? Everybody that walks onto the ward? Who are you asking? How are you going to get permission to approach the people that might be on a particular ward or setting? And what is your role as the researcher when you are in that environment? And sometimes when you read research that's been published around observations, some of those issues there isn't enormous clarity, and certainly when you're critiquing the literature, you could make some comment about the positionality of the researcher in some of the information that's being collected. So what's the role of the researcher? Are they a member of this particular group? Is there a level of subjectivity, objectivity that they need to think about? Equally, do they have to think about reflexivity? If you are collecting information about a group of people that you are familiar with, will you have a different view of them than somebody who is new to that environment? So would it be ethical, would it be appropriate for you to go and research your own team, your own group? And if you overcame the issues around objectivity and ethics, would you be the most appropriate person to be collecting that data?
If you're already informed by your prior knowledge of them, that's the problem. That's where you have to use the reflexivity to come into it.
So think very carefully, what do I already know about this group that's going to affect what I'm looking at, the way I view the information that I'm collecting? And I'm sure that we can all imagine a situation where you're analysing or observing teams, even if you simply just thought about it in terms of your own professional team meetings. If you were doing a piece of research on that as a ethnographic study, would you be able to set your Rona's making me laugh now, which is not fair. This is where you should webinar against a blank screen.
You should.
We're thinking about, I wouldn't want to do any research on my particular team here, but anyway. But what do I already know about the people that I'm observing, and is that colouring my judgment, is what I'm trying to say. And therefore, have I sampled them appropriately? If I'm picking people on purpose because of what they know and what I think they know about a particular subject, am I getting enough variation to make any kind of genuine conclusions around my data? So when you're looking at research that's been published, qualitative research that's been published, do they make some statement about how they sampled and what was the role of the researcher and so on? And it's important that they've made some discussion. And you may find actually this commentary in the limitations to the study section, because often you bracket, when you publish a piece of material, you bracket some of this information and you put it in the limitations section. So it's worth having a little look at those sections of the published material. So, jumping one slide there. Other issues to think about is the multi-method approach. Hopefully all of you can think of an example of qualitative research if you haven't got one to analyse for your narrative review. And they've used more than one method of data collection. So if I was proposing to do a piece of research, I'm not just going to collect the data in one way, I might collect it in a number of different ways to ensure that I've got a very holistic picture of the phenomena I'm researching. In qualitative research, we use a phrase that everything is data. Every conversation, every exchange, every piece of information you collect might have a value. So you can end up with an awful lot of data to analyse. Equally, you need to stop at some point, and we talk about data saturation, theoretical saturation, when we talk about collecting material in qualitative research. We've already mentioned a little bit about detachment from the field, so the researcher as a friend or advocate, and is this ethical? So if you were researching your team, would it be appropriate to do so? If you wanted to look at, team relationships in clinical settings, maybe it's more appropriate to go to a different team and analyse that, and maybe then reflect it back on your own team. One of the things I think any qualitative researcher would admit, that all of this is very time consuming. Collecting qualitative data can be a long process. In quantitative research, you often have very fixed segments of data collection because you have done an experiment, so it's a very finite period. I'm going to do something to a group of people and then I'm going to evaluate how effective it's been, for example. In qualitative data, we don't tend to have that sort of constraint of time, which can be useful, but equally it can be quite challenging. There's many different software packages out there, and you will see them cited in the research that's published. NVivo and QDIST and all sorts of things, that packages that you can use to pull out data from your, pull out themes or pull out information from your data. And some of those are used very well in qualitative research. We've talked about the role of the researcher, but there's a theoretical component to any qualitative research. If we're looking at a grounded theory study, we might be generating the theory from the data that we're collecting. If we're using another methodological approach, like phenomenology and ethnography that we cited when we talked about research methods, we are starting with a theoretical point. And when you read research, it should be clear what theoretical stance the researcher has or is taking to their research. And sometimes I think in nursing research, some of the material published in what I would consider to be very reputable journals doesn't make the theoretical component very clear, and I think that's a flaw.
I would agree with that. I think they're still, I think in many of the nursing journals, they're still stuck in the medicine paradigm of research as opposed to moving forward with theories. And you talk about theoretical frameworks and everyone goes, like that. And I think that's one of the issues, is just they're afraid of it, maybe. And we shouldn't be.
I think certainly you will, and I'm sure some of you have got some articles from, for example, the Advanced Journal of Nursing, and they are very wedded to the biomedical model. And even though they're talking about qualitative research, it isn't always very good qualitative research. And I think if you want to look at really good qualitative research, sometimes you have to go to the sociological journals.
I think so. Move into the social sciences and you'll find better examples.
So some of you who are working in health genetics, and you might find some excellent examples in the psychology journals. But you know, and I'm a nurse, so I'm being sort of quite self-critical here. I think some of the nursing journals can be quite theoretical light, for want of a better expression. And so you as postgraduate students should be looking at what the theoretical basis is, and maybe asking some questions about why it's not obvious and what theories need to be developed.
I think so, and I also think if you look at sociology, there's an awful lot of literature on medical sociology. So there's a wealth of appropriate theories and theoretical frameworks out there. And in postgraduate work, don't be afraid to just dip outside of nursing and healthcare to actually get evidence that supports what you're looking at. It's not saying use it exclusively, but just saying look at it as well and don't be afraid of it.
Mm. So if you've gone to Medline or CINAHL as your databases, I think it's important that you look maybe at slightly less medically orientated databases.
Mm. And if you look at SAGE, it's not so much a database, but SAGE journals,
yeah,
they have a lot of information.
Now all of those, if you've used the library Primo Search, they will be searching all of the different databases, which is why it's a good method to use, but it is important to look slightly outside the biomedical model. So if you were looking at, for example, patients' attitudes to health promotion, again, a lot of health promotion literature crosses over into the sociology and the psychology arena. So yeah, don't be nervous of it, but I think at this level it's something to think about. Any questions at that point? No wild typing going on?
Not yet.
Not yet. Okay, so I'm talking about the studies bias. When you're designing a study, you might ask yourself, why are you interested in this particular question or issue? Have you got a theoretical or practice-related or political or personal motivation? So you might start your introduction for this narrative review asking yourselves the same question. What's your particular interest? Is it likely to direct the way you approach the field? The questions that you're asking and the analytical strategy that you take is influenced by who you are and what you know and where you've been and what you've done, and you need to accept that. I mean, it's in quantitative research, that's meant to be all set aside so that you can be truly objective. I think they're fooling themselves, but anyway, that's, you know, I think in qualitative research, it's appropriate to just make it evident so that you can accept it and embrace it and make it part of the study that you're doing, if you're doing research. But equally, you're going to have these thoughts when you are reading research, because I can pick up a journal and read a journal article and have a particular opinion of it, and you can pick it up. One of you comes from a completely different background, academic background or practice background than I do, and have a completely different opinion. And neither opinion are wrong, but you need to embrace that and think about, you know, what are you looking at? Whose eyes are you looking at this from? If you're a critical care nurse, you're looking at things in a particular way. If you work in genetics, you're looking at things in a particular way. If you're a paramedic, you're looking at things in a particular way. So when you set the scene at the beginning of your assignment, it might be worth making that point evident. One of the things that I often think is quite interesting is, if you're looking at a piece of research that you've found in a journal, is having a look at the people that have written it. Certainly the key author. It's always worth a Google.
Yeah,
See
absolutely.
who they are, what have they written, and certainly, and you may have found this in your particular fields, there may be a name or a couple of names that keeps recurring, either as the primary author or subsequent authors in particular studies, because people become well known and publish around a particular field. So who are they? And what have they written in the past? And has that had an influence on what they're presenting now and how they're presenting it? So, has everybody still got sound? My audience view has just gone red.
No, everything looks okay from here. Can you hear us? Yep, not hands showing. Yes,
Okay.
thank you. Thanks,
Lovely.
Anna.
Sorry, I keep getting a flash of red across my audience view, which suggests that the sound is...
No, we're all good.
Okay, good. Right, so when designing a study, you might consider access, as we've said, and your role. Are you an insider? Are you an outsider? Do you have membership? Are you peripheral membership or active membership? Who are the gatekeepers? How do they impose restrictions to your access? And can you get access to the data that you need to investigate your research? So this is when you're undertaking research. But equally, when you're looking at research that's been written, who are the people that are writing it? There's a couple of studies that I was looking at recently with some undergraduates, which were observational studies that staff nurses had done on each other. And you would look at that material and think that there were an awful lot of flaws into that data collection for all sorts of reasons. Sampling is a huge issue when we talk about qualitative research. It's a real consideration to look at how your sampling strategy has been undertaken. So when the research that you're reading hopefully has articulated very clearly how they've identified who they wanted to talk to. And we often use purposive sampling in qualitative research. It's about choosing people to include a variation of perspectives within the category which is relevant to your study. So if you want to talk to student nurses, then if you want to find out what student nurses think, you need to talk to student nurses. So we've picked this group of people on purpose because of what they know about the particular area. But hopefully, if I wanted to know about what student nurses thought about something, I would pick a wide variety of student nurses, male and female, a broad spectrum of ages. So from your 18-year-old just out of school up to your 50, 60-year-old. Not many 60-year-old first-year student nurses, but we have got a few 50s. And so the perspectives of a student nurse would be massively different because of that age range and gender and other educational backgrounds, the route that they've come into nursing through, the social background, their ethnicity, their upbringing, all sorts of issues that you'd have to take into account. And this can mean that you can get overrepresentation of certain groups. So if I was looking at the views of first-year student nurses, the chances are that I would get a lot of 18-year-old girls. Now, not because I want to speak to lots of 18-year-old girls, but an awful lot of newly first-year student nurses are 18-year-old girls. It doesn't mean that their views are more important, but if I was trying to sample adequately, I would limit maybe the number of 18-year-old girls I spoke to, and I would want to get a variety of other groups to ensure that I've got a representation of what all first years think, if that was the aim of my research study. So some of the studies that you might be reading about, I'm trying to think of some subjects that people have been talking to me about recently.
The cholesterol injection is one of them. Yeah, so the statins, and I talked to somebody.
Oh, the use of statins?
No, it's the injections now.
Oh, right, okay.
Basically replacing statins, so they're looking at that in the population. Seeing one of the people
One of the human genetics was looking at sudden death and the causes of sudden death in certain groups. So again, you would want to get a variety of different groups, types of sudden death. So cardiac causes, neurological causes, and so on, if you wanted to get a representation of enough people to make any kind of conclusions from your sample. So ask questions about your sampling, and it doesn't matter which critical evaluation tool you've chosen to use, all of them will ask you questions about sampling.
And also look for the omissions. So what they don't say about it is actually really important. Because what they don't say, it speaks volumes at times. There may be a genuine reason for it, but there could also be something that they're just not telling us because it's actually the best piece of research maybe. So look for omissions. It's not just in sampling, it's across the board actually in what they're saying in their results, exactly, in the discussion.
Yeah, certainly when you're looking at the findings in both qualitative and quantitative research, is look for the omissions. And one thing somebody was saying about statistical, do I need to understand all the in-depth statistical tests? And absolutely no, you don't in quantitative research. But what you do need to be able to do is to find your way through the presentation of their findings. And equally, you need to be able to find your way through the presentation of the findings in qualitative research. So if they're making some conclusions, and this is when it's sometimes a good thing to read the article from start to finish initially, but then have a look back and forth. So look at the conclusions they're making, highlight the key conclusions they're making, and then try and find evidence of those conclusions in the findings, the presentation of findings. Because if they make a conclusion, you should be able to support that with a statement somewhere in their presentation of findings that gives you evidence of that. And if you can't find that, then you can make some pretty scathing conclusions about the piece of research and say that the findings don't match. And equally ask questions about sampling. So the choice of method. So if you come on to the next research module, we'll talk a lot about the choice of method and research aims and objectives. When you're reading a piece of research, it's very, very important that you look at the research aim or statement that they've started with, and then have a look at the method that they've taken to collect the data. And if they don't sit together, they don't match, then you can make some statements about the research's ontology and epistemology, which great words, but I really think it's important that you start thinking about, where is this piece of research sitting, and does it match with what they're saying? So how did they get the data that address their research question? If you want to find out what somebody's thoughts or feelings are about a particular phenomena, then observing them is not going to give you that information. So if they've used participant observation or non-participant observation, and they've said that they've found out how people feel about something, then that doesn't match. I mean, obviously that's a slightly extreme example, but it is important that the process sits together well. And as I said, using multiple methods of data collection often gives us a far more holistic picture of the particular phenomena, and therefore allows us to make some appropriate conclusions. So we can use a mix of methods. We can use some quantitative methods of data collection in a qualitative study. People often ask, do I need this many qualitative studies and that many quantitative studies in this review? No, you don't. You absolutely do not. But equally, if it's got numbers, then it's going to be quantitative. Again, that's not the case. Often we use quantitative methods in qualitative studies, and we use qualitative methods in quantitative studies because they support the research aim that we've started, research aim and objectives that we've started out with. So you might see a study on quality of life in cancer patients, breast cancer patients, and they might have started with some very large survey that sent out a quality of life tool questionnaire, really quantitative, where they've been scored on their life and their activities and their all sorts of different categories and different quality of life surveys that they use, and come up with some statistical analysis. But that's been then followed up with another method of data collection, and they've done an interview or they've done a telephone follow-up or something that's supported that survey data. So the survey alone wouldn't have addressed the research question. Any questions before we talk about types of analysis?
No questions so far.
I'm just going to pause while I have a drink. Okay, so, sorry, just having a slight, oh, is there a question?
Just as no.
Oh. Any questions at all? Oh, good. Okay, so in your studies, you might have come across a number of types of analysis in your qualitative studies. You might have come across content analysis, thematic analysis, or hermeneutic analysis, and we're just going to touch on those three types. I'm going to spend probably a little bit more time talking about thematic analysis, just because it's a really important aspect to your narrative review. So if I'm talking about content analysis, it might examine text, transcripts, social interactions, so there might be interviews, there might be conversation recordings, all sorts of different types of data, usually around communication, and it's a type of descriptive analysis that can be done to pull out the content, so the actual material. So you might look for particular words or particular phrases or particular use of language. But what it doesn't do is it doesn't reveal motives. So there isn't any hidden agenda behind it. So you need to pull out. If I was doing a piece of content analysis on a conversation or a focus group, I might be trying to pull out particular words or phrases or particular things that people are saying recurrent across the conversation. So I might have, if I did a focus group, for example, and I'd recorded it, I might have asked a group about, going back to simple examples, their infection control practices. So I might have been looking for particular content for them to explore. Anything to add, Rona?
I was going to say sometimes it's around, when you're looking for those words with that approach, it's about how many occurrences there are. So it's a bit of number crunching as well. So we've had 10, uses of this phrase and 10 uses of that. It doesn't tell us why they're using that phrase. It gives us no depth at all. It's just that sort of superficial data.
So if I had, again, going back to my content analysis of a focus group of infection control, I might see how many times they mentioned positions of sinks, because often, hand washing and so on is to do with facilities. So I might look at how many times they've mentioned facilities, how many times they've mentioned sinks, how many times they've mentioned specific types of conditions or and other particular content related to the themes that I'm hoping to explore. But as Rona just said, it doesn't tell me why or what the issues might have been. So it often sits with another form of analysis. So we can end up with a focus group and say that 50 times they mentioned this or 25 times they mentioned that. So I can make the conclusion that the thing that they mentioned 50 times is more important than, or more significant than the thing that they mentioned 25 times. But I don't know why. And I might need to follow that up with an individual interview to say, is this more important to you than that, or why is that the case? So it often sits with another form of data collection and another form of analysis. In thematic analysis, I'm pinpointing, examining and recording patterns. So I'm trying to explore if there are certain data sets across my interview or focus group transcript that reoccur across all of them, and see if themes are appearing. And this is actually what I'm asking you to do in your narrative review. I'm asking you to look across the data that you've collected, and the data for you is the articles, and said what themes have come out of this. So if, for example, you're looking at infection control in ward environments, there might be 10 studies, and all 10 of them have mentioned sort of estate issues, so sinks and hand washing facilities. And 4 of them might have mentioned education, and others might have mentioned skill mix, and others might have mentioned workload. So what I'm doing is I'm finding themes across the data that I'm collecting that can explain and give meaning to the data I'm presented with. So that's what you might do if you had a collection of interviews or focus group transcripts or so on. But it is actually what I'm asking you to do to your data, being your articles. I think.
I don't actually think so. I think that covers it quite succinctly. It is about, the only thing I would say, and it's one that I sort of trot out every time, is the idea of themes in the data will always still be informed by your experience, your prior knowledge. And that's where this reflexivity comes into the whole idea of qualitative research. And as healthcare practitioners, we're usually fairly good at reflexivity, or we should be anyway. But so they don't just arise, you've got some knowledge there, so you know what you're looking for.
So you might have gone into, a lot of you have actually come to me and used this particular phrase, I know where I want to go, I know where I want to end up, I know what my research question is going to be at the end, which is a little bit of a cart before the horse approach, but it's not, there's no problem with that. It's just, okay, I'm now taking 5 or 6 steps back to see how I'm going to get to that research question, to make it a valid research question. And so you might need to start broadly about looking at the research and seeing if those themes then develop. Do we have a question?
We have a question. So does that mean critiquing the papers on each theme identified in the review?
Okay, so for each theme, so again, going back to my very dull hand washing example, but we all know what hand washing is, so that's why I use it as an example. And one of the themes that comes across the articles is that education is a factor. I would then talk about education as a theme, and I would look at study Smith 2010 used an observation strategy, and what was good about that, what was poor about that, whereas this study used a particular approach but came up with very similar conclusions. So you're looking for matches and mismatches and critiques of the methodological approach that each of the study has taken within that theme. So there's a sort of, I draw it out for some of my students, that you've got this sort of linear approach, you're critiquing each article in turn, and then you're looking for patterns horizontally. And then what you present to me is that horizontal discussion. Does that make sense?
Makes sense. Just to me.
Does it to our audience, though, Raina?
Say so, yeah.
Did that answer the question?
Is it? Are you okay with that? Yeah. No questions? Yes. Yes, thank you.
Okay, good.
Well, thanks, Debbie.
Okay, so when I'm looking at hermeneutics is a great word. Rayna's shaking her head. I like looking at hermeneutics. Hermeneutics to me is really important. I like thinking about language because I think we can, in practice and in any personal and social exchange, we can use language quite flippantly. And sometimes, as I'm sure you can all think of a situation where you have used a phrase and it's been misinterpreted. It's been taken out of context. It has been used inappropriately, or you've said something and the meaning has been taken, not necessarily been incorrect, but it has been taken as something that you did not mean it. And so when we're collecting data from people and it is in the form of written language or verbal language, we need to be very clear that we understand what they're saying. And that might sound a little bit simplistic, but if you ask somebody a question and they answer the question and you think, I don't understand the answer, or I don't understand the question, then are we then running into difficulty? And so understanding language, I think, is really, really important. And so the way we interpret language and understanding either the written word or the spoken word is something to think about. So in pieces of qualitative research, there are often some levels of hermeneutic analysis where they've looked at the words themselves. And this is, again, talking about a theoretical perspective, moving from theory back to practice and then back again.
Sorry, I was going to say, I think there should be more actually looking at language. I don't think we're doing it.
One thing that I found very useful when I was doing my first master's was and it got a little bit tiresome, I have to say, after a while, but our supervisors, when we were doing our research, made us, this is a poor phrase, advised us very strongly to undertake something called a content analysis, concept analysis. Be very careful of language here, Rachel. Concept analysis of every word. And that's an interesting thing to do. So I, for example, in one piece of research I looked at intuition. So I started off by doing a concept analysis on intuition. So what did it mean to me, and what did it mean to my peers, and what did it mean to the people that I was interviewing? So as I was interviewing newly qualified staff nurses, before even asking them about what intuitive decisions they'd made, I had to firstly ensure that their understanding of intuition was either the same as mine, or if it wasn't the same as mine, have a clear understanding of what their perception of the word was. Because if I didn't do that, and then I asked them a question about it, the data that I would collect would be very flawed. And I don't think we spend enough time ensuring that the words that we use are clearly understood by the people around us. And I'm sure you can all think of situations, and especially with medical jargon and medical phrases that we often use, and we bandy them around as commonly used phrases, that they do not have the same meaning for our patients, and sometimes they don't have the same meaning for our peers. And I've used language in class and had the assumption, which I'm having now, that you all understand every word I'm talking about, and that assumption might not be fair. There may be words and phrases that I'm using that you are not familiar with and that you do not understand, or you don't have the same understanding of those words as I do. And so if we're not starting on a level playing field at the beginning of our research, and the researchers aren't starting on the level playing field when they're undertaking their research, are we all talking on slightly, woolly ground?
And then that affects your results.
And then that will affect your results. So if I asked a group of, and I did ask a group of newly qualified staff nurses if they felt they'd used intuition in their clinical practice and they didn't know what intuition was, or they had a different definition to intuition to me, then the data that I'd collect would be flawed. I therefore wouldn't be able to make any genuine conclusions about what they told me. And so I think a concept analysis, and if you have a look online and what a concept analysis is, it's literally looking at a particular word or phrase and unpicking it. And even if you don't do it formally as part of your research, I think it's important that you do it informally for yourselves when you come to move forward with your, and if you're, some of you may go on to the dissertation module with Rona, and it's an important thing to have done so that you really understand what you're trying to find out. And that's hermeneutics. There you go.
Well done.
And it's such a great one.
It is a good word. But only when you know what it means.
And now you do. We're like a double act today, Rona, aren't we?
It's a good job we can't see us.
Okay, so the process. And this is the same process that you're going to go through with your research articles as you would with any kind of data that you've collected as a researcher. So if you've got an interview or a focus group or something of that nature, you would transcribe it. The thing that's really important, and it says there, read it over several times. I'm sure you've done this, and I certainly have done this. I've read something for all sorts of reasons, whether it's the time of day or my own mental state or what I'm doing at the time. I'll pick up different things when I read it again, and I'll pick up different things again when I read it again. And so people say to me, oh, I've read the articles, and I go, have you just read them once, or have you read them more than once? And I think it's really important that you read them more than once. Now have a quick skim read of them, make sure that they're what you need, and then start rereading them. And then make notes on each of the sections, and then reread them again, looking at those notes. And this is where you might start to find some basic codes, basic themes. You might decide to do it, you might have a physical method to do this. You might use highlighter pens, you might use computer and cut and paste text into boxes. There's all sorts of different methods that you can employ to make this process work for you. I've used colour-coded pens in the past. I've cut up articles and put quotes in boxes in different areas of my dining room table. I've cross-checked those codes against, I've come back to them the next day. I've had certain participants' interviews all printed out on pink paper and cut those up and put them in piles, and all sorts of different methods that you can use. But I think it's important that you do this to your articles. Read them, reread them, and read them again.
I was going to say, it doesn't have to be anything sophisticated.
No.
Just be mine's a really basic one of a numbering system with keywords against it, and I just put them in piles basically of that, and then I go back to them again. But it's just don't sort of overcomplicate it, but equally you need to do it.
I have green, blue, and pink piles of paper that's literally across my and colour-coded felt pens, which my children nick, and then I don't have them. And then ensure that those themes make sense to you. So as I said, you've got these codes, these groups, these categories that are grouped together under themes. And you might want positive examples of those themes and then negative examples. So you're looking for things that confirm what you're thinking, and maybe you might have some anomalies. So you might have a study that found 2 of your themes but completely excluded your 3rd theme. Doesn't mean that that's problematic. It's just something that you might want to highlight You might want to look at whether their methodology didn't allow them to explore that other theme, or whether it was something to do with their sampling, or whether it was something to do with their research technique overarchingly. So it might be a critique, or it might be a commentary. Remember that critiquing something isn't always criticising something.
So it doesn't have to be negative.
So often, and that's sometimes a pitfall that we fall into, that we think that critiquing something has to be criticising something, and often it isn't. Sometimes it's pulling the positives as well. Ensuring rigour, that's a topic that we look at extensively across qualitative research, because we're looking at the quality of our qualitative research. So when you're looking at those findings, are they real? Do you think they're trustworthy? Do you look at those findings of the research and go, yeah, I think that's about right? Or do they not sit well with you? And if they don't sit well with you, having the knowledge that you already have around your subject area, why is that? Have they used more than one method of data collection? Have they got lots of different data sources? Have they made it clear how they got their material in their research? Is there an audit trail? Is there a process that you could follow? Can you look at the research that's been presented in front of you and go, yeah, okay, I can see how they did that? Have they got some sort of responder validation? So if you've interviewed somebody, have you had some validity of that interview? And it doesn't always mean sending that interview back to the participant and asking them to read it through. Sometimes it does, but it doesn't have to. But equally, if you've coded it and pulled out certain themes from it, have you sent it to another author? A lot of the material that you're viewing will have multiple authors, and the assumption is therefore made that there's been more than one set of eyes on your data analysis. But you can't make that assumption, so hopefully they make it clear what they've done. I have done that in the past. I have transcribed interviews and sent them back to the respondents for them to check. That has benefits, but it equally has problems. Certainly if you don't do it quick enough, they've sort of forgotten what they said, is one thing, but equally if you do it quite quickly, which is often difficult, when they see the written word, it doesn't exactly tell you what they meant it to say. So there can be some problems with getting responder validation.
I was going to add to that. I do know of a researcher who did a huge study like that and actually sent the interviews back to the participants and then couldn't use any of the research because they said there wasn't what it meant, and the whole study was abandoned.
Oh no! I won't be doing it for my doctorate. I'm not sending my interviews back to them.
It sounds a good thing to do, and you know, ethically you think that is a good thing to do, but if you want to be able to use the research, then it's not necessarily a good thing. Now, Martin's good question: is observer blinding a way of increasing rigour?
Okay, well, firstly, let's be hermeneutic about this. What do you mean by observer blinding? Because that's quite a loaded phrase.
It is.
Do you want to open Martin's mic?
Yeah. Let me just sit with my I'm just going to open your mic, Martin, if you want to speak. Okay, can you hear us?
Hello.
Hello.
Hi, can you hear me? Hi, yeah. I've just I've got a few articles, some RCTs where the nurses that are administrating an intervention on a group of parents are blinded to the control group and the intervention group. So I just wanted to know whether that will increase the rigour of basically what they're doing.
Yeah, okay, so what you're talking about here is, because you're talking about an RCT, then you're talking about a quantitative study, and our measures, our measures of rigour and trustworthiness in a quantitative study are slightly different from those in a qualitative study. But you're absolutely right, having what we call double blind does improve rigour in quantitative studies, because what you're doing there is the person doesn't know what they're getting, but equally the person giving it to them doesn't know what they're getting. So we talk about blind and double-blind studies, and that does improve, because what we talk about in quantitative studies is we talk about internal and external validity.
Right, okay, cool.
Rather than what we talk about in qualitative research, which is about trustworthiness and my mind's just authenticity. So they're slightly different language that we use when we measure quality in qualitative research rather than measuring quality in quantitative research. Does that make sense?
Yeah, that's lovely. Thank you.
Okay. Okay, so just remember that you are your measures are slightly different. The questions that you're asking of the material is slightly different depending on whether it's a qualitative study or a quantitative study. So we've talked already about reflexivity a little bit, but also it's something to mention again, certainly when you're reading research, but also when you're doing research yourself, is the awareness of how it might influence the process that you're undertaking. And has the researcher shown you an insight into his or her biases and the ways in which they could have influenced the outcome of the study, and equally if they've influenced the way you've collected the data? So if you are undertaking, if you're reading a research study where the person who's done the research is involved in the particular group, have they made some, they've given you some insight into what they already know and who they are? Any questions? Nope. Oh.
Nope.
That was quick. So there's a whole series of pieces of well, I've taken 2 hours to do this session in the past. I don't know how I've done it quite so quickly today. Any questions on qualitative research? Have you had the chance to look at the narrated PowerPoint by Bridie about quantitative data analysis? Because that's the other half of this afternoon. Have they or not?
Not yet. Well, Emma says not yet.
Just one.
One says 3/4. No, not yet. Not yet.
Okay. So remember, this is one half of the coin, and you've got the other half of the coin to look at as well from Bridie. So if you're looking at the two types of research that you might have collected, you've got your qualitative on one side, you've got your quantitative on the other, and you've got another presentation to look at around quantitative research and how you measure and how you analyse quantitative research.
Janet says, I can't hear the narrative for any of the narrated PowerPoints.
Oh.
I'm going to have to find someone with a computer.
Okay. There are two different types of programme. The quantitative methods session uses, well, I checked it when I looked at it, and Bridie's session, certainly I'll check it.
That can play it back. Shows it. I'm going to have to use, find someone with a computer that can play it back.
All right, okay. I did, I'm just going to check Bridie's. I'm just flicking around the, any questions at all? Mm-hmm. Had anybody given any thought to, I know some of you have already contacted me regarding tutorials and how you want to work that the 12th. But did any of you that are here this afternoon have any thoughts about it? I've lost it. Where's it gone? KPP 702. Comments? Under the little fox.
So what I'm going to do today, and I apologise for not being with you in person, is I'm going to talk about quantitative data analysis.
Okay.
And give you a bit of a... Now,
can you hear that?
Now, I've called this... This is Janet's book.
Well, the sound is working, so I've just had a test.
Somebody else has said it's working.
Okay. Okay, so that's the other half of this afternoon, if you see what I mean. And I don't know whether it works on everybody's, but certainly when I do it, if I press it forward each slide, then the narration works. I haven't tried playing it, but I have tested it and it works okay.
Yeah, somebody's saying that they can't use the one at work, but they can use it at home.
Oh, right, okay.
I can hear it now, but when Janet says, I can hear it now, but when going to it later, direct from the laptop, it tells me I don't have appropriate software.
Did you do it through the DLE?
Yes. That's the laptop, isn't it? So you probably need to find one that's got the software on it, or download the software.
Or download the software. But if you've got Google Chrome on your computer, then you've got the software that's required. And Google Chrome is available for free. So you should be able to hear it. So I hope everybody else is able to listen to the other half of this afternoon.
Paul says if you click on the speaker symbol on the front screen, that seems to activate the verbal embedded materials on the PowerPoint.
All right, thank you, Paul.
Thank you, Paul.
I do try and test them to make sure they're working. Bridie wasn't available to join us this afternoon, but she did it in advance for us.
That's good. Jen says she'll try it. Should we contact you to arrange a specific time for a tutorial on the 12th?
It's up to you. As I've said, I'm going to be doing an open webinar from 1 o'clock. If you feel that you don't want to join me then, or you feel that it would be more beneficial to have either a phone conversation or on that day, then that's absolutely fine. Equally, some of you are very welcome to go to Rona. She's shaking her head. What do you mean?
No, I am here. I am here that week. I finish on the 14th for Christmas break.
So on the 12th, I'll be available all afternoon.
I'm here as well.
And I'm also available on the Monday if you want to speak to me on the Monday. But I am available on the Monday. But I am available all Tuesday afternoon. What might be useful, and it's completely up to you how you want to play it, but if you want to send me an outline, by a fortnight's time, then maybe Rona will respond to some and I'll respond to the others.
I'm around on the Monday.
Okay, so
but I'm not. I am on the Tuesday, but I'm not teaching all day Wednesday.
Okay. So it's really up to you. I sort of want your tutorials to work how best that you for you, really. If you think that sending me some material and then us talking on the phone will work better, then we can have a conversation. Equally, I will be available all that Tuesday afternoon. I'm not going to chase you. I'm not going to force you to have a tutorial. If you don't feel it's necessary and you just want to get on, that's absolutely fine. Equally, if you just want to start writing and see how you are doing, then again, you're very welcome to. You can send drafts up till Monday the 22nd of January, and up till that point, I will respond to emails.
Yes, we can't in the last week.
So after the 22nd, we can't really respond around content, but obviously if after the 22nd you can't remember how to upload the submission to the DLE or something like that, of course I will respond. What I will do on the 12th is just very quickly go through how you upload the presentation for those of you who haven't used the DLE for submission in the past. Equally, a little, just a tip, which again I will cover on the on that last day, is have it in a Word document or a PDF. If you submit it in some bizarre format that I can't open, then unfortunately I can't give you the opportunity to change it. You get 0 and it is your second attempt, and that is university policy, I'm afraid. So what I would suggest is once you've uploaded it, close all your programs down, open them all back up again and see if you can open it. If you can open it on your computer, then the chances are that I will be able to open it and Rona will be able to open it. If we can't open it, we can't read it, we can't read it, we can't mark it.
That's very true. And it does happen.
And it does happen, and unfortunately the university's become very strict on submissions via the DLE. So, but we will go through that on the 12th just to make sure that you're all absolutely clear.
So you just said, oh my God.
What?
Just said, oh my God, Anna. What's worrying you?
What's the OMG for? Come.
Just going to unmic you, Anna, so you can talk to us. Okay?
Hi, Anna.
So scary to think it won't be valid.
Oh, yeah, it happens very, very rarely, but we, certainly for some of us who are working across different platforms, and this is where my IT knowledge starts to get a little bit sketchy, but I work with an iPad and a Mac, and sometimes if you upload it to Notes and other programs that are Mac-based to the DLE, I can't open them on the computer. So in the past, we've been able to just email you and say, I can't open this, please give me another submission, but we're not allowed to do that now. We have to give you the information up front and so that you can upload it in the correct way first. So that's just a tip. Any other questions? Oh yes, no, I will. Apologies for that, Debbie. I will. I read your email, and I will respond to you. What actually, if you wanted to give me a ring in about half an hour, 40 minutes in the office at 3 o'clock, would that be okay, Debbie? Okay, I will respond, but I will be back in the office if anybody wants to give me a call. There was another question about critiquing tools and which ones to use. I'm not going to prescribe that you use a specific critiquing tool. my suggestion is that there are a number of critical appraisal tools available, and you need to find the one that works best for you. If you open any research textbook, the Moulin Heck textbook that's on the Talis Aspire reading list, the Pollitt and Beck, the Pollitt and Hungler, they've all got critical appraisal tools in the back to support your analysis. Please cite which one you're using, and there isn't a specific one that I think is the best. I quite like the simpler tools because I think they pretty much ask the same questions. They ask you questions around the aims, the methodology, the method, the analysis, and so any tool is appropriate, but just reference it correctly.
Sharon's asked, is it okay to adapt an appraisal tool if it doesn't quite match your purpose?
Absolutely. Often the critical appraisal tools ask many questions, and some of those questions aren't relevant. So sometimes what I advise is that you put the critical appraisal tool in the appendix and you make some reference in your text to how you've adapted it and how you have maybe excluded certain questions that weren't relevant.
Especially when you think how many different methods there are and they're being developed all the time. And not going to keep that.
No. I mean, really, a critical appraisal tool is there as an aid memoir to ensure that you're asking the right questions of the research that you're reading. It's simply a theoretical tool to help you.
It's a prompt.
Okay, so that is qualitative research analysis. You've got quantitative research analysis to either view now or view at your leisure. And obviously this recording will be available online in the next 20 minutes for you to review. I will be back in my office in about half an hour if any of you want to call me. And if there are any questions related to tutorials, then please email me. We're together again on the 5th of December, on the Tuesday afternoon, to talk about research ethics. There's a YouTube presentation by Ruth Endicott, which will be uploaded in advance, and then we've got a session that's already up and available online to discuss. Okay, so that's it for this afternoon from me. Don't hesitate to contact me if you've got any questions. Anything to add?
No, nothing else to add. Thank you very much. See you on the 5th.
Good to see you on the 5th. Thanks very much.